And could right ventricular outflow tract ventricular tachycardia occurs in the absence of apparent structural disease?
Yes, VT can occur that comes from the outflow tract in individuals without any structural heart disease. And this VT can be very symptomatic and actually cause syncope. And if it is frequent enough, can even cause a cardiomyopathy, even though they don't have any genetic predisposition to a cardiomyopathy.
How to detect abnormalities in patients with right ventricular outflow tract ventricular tachycardia?
Yeah, that's a very important question because when people present with VT that comes from the RV outflow tract, it could be idiopathic or with no underlying heart disease, or it could be a result of some underlying heart disease. There are a number of things we use as cardiologists to determine whether they have heart disease or not. The first is the 12-lead EKG, and there are some characteristics on the 12-lead EKG that are more typical of RV dysplasia than of idiopathic VT. Then we can do specialized imaging, which includes echocardiographic imaging, MRI imaging. These imaging, certainly in advanced RV dysplasia, would be very typical and able to distinguish. But we're learning more about subtle changes and what they mean for distinguishing RV dysplasia. And finally, you can do an invasive EP study where you can do voltage mapping, and voltage mapping picks up scar, and scar would not be present with idiopathic VT, but would be present with underlying heart disease. So there are a number of modalities we use in this day and age to determine the difference.